What can we do about vaginal vault prolapse? There are many options for treatment of vaginal prolapse. One is to try physical therapy, and that's often baseline. However, by the time most patients have seen me, they're already doing physical therapy in some form on their own, such as Kegel exercises, squeezing like you're trying to stop the flow of urine, but not while you're urinating because we don't want to cause a bladder infection. We do that, I recommend, every time you see a commercial on TV, you squeeze and hold it for 10 seconds, or see a red stoplight, squeeze and hold it for 10 seconds. After physical therapy, one option is to see a true physical therapist, a female physical therapist who helps you to learn how to contract those muscles. Sometimes we use electrical stimulation to help you contract muscles you didn't know you could contract, or to help with that. There is a home physical therapy device called Intone. Intone is a device that goes in the vagina and you squeeze against it. It also has electrical stimulation, so it does many of the things that you would do at a physical therapist's office, but instead of an hour-long session once or twice a week, it's a 10-minute session that you do 6 days out of 7 for 12 weeks. Specifically, Intone was designed for incontinence, but may help with prolapse. With regard to prolapse surgery, there are many treatment options. Most traditionally, we repair vaginal prolapse vaginally, and I prefer to specialize in what I call non-mesh surgical repairs. Truth be told, that is probably the more traditional approach. That is, we use your tissue to repair your tissue. How do we do that? It depends on what is going on. So if we think about the support for the bladder being held up by a sheet of tissue, which we call a vaginal septum, if you will, or sometimes it's a ligament, but people argue about what it is, but there's a supportive layer of tissue between the vagina and the bladder. And classically, it runs from the pubic bone to the cervix and holds the bladder up much like a hammock would hold a person up. Things can happen to a hammock. Things can happen to that supportive layer. Something can break at one end, in which case it drops. If that's the case, we go in and we re-support the top. If someone cuts a hole in it or we tear a hole in it, such as with childbirth, we repair the hole. If it is stretched out, we often put pleats in it, much like you might put a pleat to gather things in and tighten it. The advantage of these techniques is that they use your tissue to repair your tissue. The disadvantage and the advantage of that is that we very rarely reject ourselves. So we don't have to worry about typically the pain with surgery or infection or not tolerating the material very well. The disadvantage is that your tissue has already failed once. Something has caused it to fail, and so we're using you to repair you, and at some point you will wear out again. Same can be said for the rectum. Same approaches. So again, with the rectum is here. The rectum can bulge into the vagina, which we call a rectocele, and we can repair that layer by correcting the support around it. And one of three things has happened. Either something broke at the top, in which case you resuspend the top. Something tore a hole in it, in which case we fix the hole. Or if it's gotten too loose, we tighten it with some pleats.